November is Lung Cancer Awareness Month. Nearly 2 million people die from lung cancer around the world each year. That's more than any other type of cancer here in the U.S. It's the leading cause of cancer death in both men and women. Typically, when we think of it, we think of older smokers, but that's not always the case. To learn more and to hear from a survivor, let's head over to senior health correspondent Monica Robbins in Studio B. Good morning, Monica.
Good morning, Danita. Yeah, when we visit the hospital, we often forget the people we meet there, sometimes have their own health journeys, and we can learn from them. And Tony Holland is definitely one of them. Thank you so much for being here.
Thanks for having me.
You are a lung cancer survivor, and you have an interesting story of how they actually found your cancer. How did that all happen?
Well, I had an episode of pancreatitis, like 4 episodes, and then they said I would never have it again, and ended up having one like 3 months later after I got out of the hospital, and that's when they told me they spotted something on my lung when I went back in and got it checked out, and it came back positive.
My goodness, and so they told you you had lung cancer. Were you a smoker?
Back in the day, I smoked.
So lung cancer, that had to surprise you though.
Yes, because I never thought I'd be the one getting it.
Now, how many years out is this now?
Almost 8.
Wow.
Almost, wait a minute, 7, almost 7.
7 years, and the interesting thing for you is you are a patient transporter at Cleveland Clinic Akron General.
Yes.
So you transport patients usually who are going where?
To get a biopsy done, then if they have cancer, and I talk to them and let them know the journey I went through. And they don't have to go through it with family and friends. And we have long talks.
So what do you tell them?
That I went through this almost 7 years ago. And if I can do it, you can do it. Family and friends, just stay positive. Don't worry about it, just do what you got to do.
That has to be really difficult for people to hear when they're going into a biopsy or they're, being told they just had cancer. How do you inspire hope?
From what I learned and went through, I let them know. If I can do it, you can do it. Just stay positive and don't worry about nothing.
Something else interesting about your case is you were also part of a clinical trial. Can you talk about that?
Yes, they put me in a clinical trial to try a new drug and everything, and it helped me out.
What was the drug?
I can't even remember what it was.
What did the drug do for you?
It helped me out. It was...
Are you still on that drug?
No.
No? But it helped you?
It helped. It's almost 7 years and no reoccurrences.
So when you think of lung cancer now, do you think people take it as seriously as they should?
No. Everybody should get screened for it to make sure, especially young people.
And we're seeing more and more young people getting diagnosed with lung cancer, and many of them are non-smokers. Does that surprise you?
Yes.
Yeah, they're saying that pollution and radon gas is one of the causes, but if you don't know that you might have been exposed, how do you ask your doctor for a screening?
Well, you go to them and ask them, can you get blood tests or a screening to make sure to check that you don't have cancer.
Did you ever have trouble breathing?
No, I mean, I feel healthy.
So it's a sneaky, insidious disease, isn't it?
Yes.
So how else did you get through this when you were fighting your cancer?
Well, wife, kids, family, friends. I mean, you can do anything and stay positive.
And how do you, when you use your job to help people go through, you're a patient transporter, do you see those patients after
Yes, I do.
And what do you talk about?
They journey and they say, it wasn't like what I thought it would be. And they say, you was right.
So my understanding is a simple lung screening. If you think you might have been a smoker, good idea to talk to your doctor about
getting screened.
because a screening can prevent
Early detection. That's all you need.
if you get detected early, your chances of dying from it are much less.
That's right.
All right, Tony Holland, thank you for what you do, and thank you for inspiring patients and giving hope to the rest of us and raising awareness to lung cancer.
Yes. And we have a screening this Saturday, and it's free.
All right. Thank you so much. All right, Danita, back to you.
All right, Monica, thank you so much. Appreciate that information this morning.